Central nervous system depressants have legitimate uses, of course, as anti-anxiety agents, as sedatives, um, uh, some used for procedural sedation or moderate sedation, for hypnotics. And they have a place also in treating some seizure disorders and as adjuncts for anesthesia. Benzodiazepines are the most commonly abused CNS depressant, or I should say a commonly abused class of CNS depressants, but marijuana is also a CNS depressant that can be abused, and flunitrazepam or Rohypnol, trade name, is a club drug that is commonly abused. It's called the date rape drug because it renders the person who gets slipped some Rohypnol in their drink, for example, so sedated that they may not even remember be aware of be aware of being sexually assaulted. Um, you know how benzodiazepines work, increasing the action of GABA, and marijuana activates cannabinoid receptors and causes relaxation and just a feeling of everything's okay, happiness, and also this sensation that, colors are more vivid and sounds are more acute, the no, an enhanced sensory perception that can go along with using marijuana. What are the adverse effects of CNS depressants? And primarily, as far as the benzodiazepines are concerned, they can cause too much drowsiness, too much sedation, dizziness, paradoxical reactions in some people, where instead of calming them down, it makes them more agitated. There are GI side effects, including nausea and vomiting, constipation, can cause itching and skin rashes. With marijuana, people often experience an increased appetite and impaired memory and judgment, and what is called an amotivational syndrome, just don't feel like doing anything, not motivated to do anything. So, what happens for somebody who's been abusing CNS depressants over a period of time? You know that benzodiazepines can cause physical dependence and can also cause addiction. If the CNS depressants are withdrawn for short-acting drugs, the peak withdrawal signs and symptoms are going to occur within 2 to 4 days. For the longer acting, as long as 7 days for the peak, and then the duration for short acting up to a week, and for the longer acting CNS depressants up to almost 2 weeks or 12 days. What does depressant withdrawal look like? Sort of the opposite of what depressant effects look like. Somebody who's withdrawing from benzodiazepines, instead of being sedated, will likely be agitated and be moving a lot. Increased psychomotor activity can be confused, acute delirium, elevated body temp, sweating or diaphoresis, elevated blood pressure, tachycardia, fever, risk of seizures or what some people call convulsions. And so they may feel things like anxiety or depression, although there can be for some people kind of a paradoxical euphoria, but they may experience hallucinations, being disoriented, and again, the possibility of suicidal thoughts. Those can occur with depressant withdrawal, as you can see them with the stimulant withdrawal as well. So what is done for withdrawal from depressants? Well, if somebody begins to experience serious side effects of CNS depressant withdrawal, probably what will happen is they will be given a CNS a depressant like benzodiazepine. They will be given the medication in order to cut off the withdrawal syndrome, but then they will be properly withdrawn from the medication by tapering the drug over up to a couple weeks period of time, because you know that our patient education for people who are taking benzodiazepines who've been taking them for a while is they should not suddenly discontinue them. They should withdraw them because of the risk, withdraw them gradually because of the risk of withdrawal or abstinence signs and symptoms. So tapering the drug will, giving them the drug to cut off the withdrawal symptoms, but then tapering it will keep them from going into this really extreme withdrawal or abstinence phenomenon.